Okay, so this one is just going to be like an educative video about carpal tunnel decompression, which is a surgery for carpal tunnel syndrome, where the patient, has um, weakness of the thenar muscles as well as, let's say, just weakness of the grip. Now, if the patients want to see that, so weakness of the muscles of the hand, right, especially the thenar muscles, and also there's a paresthesia, numbness or the hand. So they can say from medical student point of view, tinel and phenol, tinel test positive, phenyl test positive. Right. So now let's talk about the surgery because most of the people they're reluctant to go for it, and from medical point of view, you will, or surgical point of view, you want to know what are the instances, what actually what you exactly deal with when it comes to this procedure. So I have done this procedure. So it's a actual procedure might take about 10 to 15 minutes, right? And what it essentially involves is just releasing the, so you have the carpal tunnel, which is formed by carpal bones, and there are tendons that go underneath, and the nerve also goes underneath that, so it can become compressed with time. So this compression causes these symptoms, signs and symptoms of a carpal tunnel syndrome. So now let's say you are going to the surgery. You're going for the carpal tunnel decompression. So what does it actually involve? What does the surgical procedure actually involve? So this is a procedure that can be done under local anesthesia. I mean, so it starts off with local anesthesia. So we give local anesthesia. Then a tourniquet is placed on your hand so that you reduce the bleed. So it reduces the bleeding. So it wouldn't be that much of an issue because, as I told you, it would be about a 10 to 15 minute procedure, same day. So you could come that day and go itself by about after 2, 3, 4 hours of observation. But given nothing, there's nothing. Usually, there's nothing complicated, right? There's nothing deep. It's mostly just releasing of the transverse carpal ligament. So what are the steps, right? So now you have given all of these things, you have cleaned and draped the patient, so everything is clean, and now you're proceeding with the skin incision. So you go through certain layers, right? And as you go through those layers, you have to identify them carefully because this type of surgeries, it's very important to identify structures. There's no need to go fast. There's not a lot of thing that you're going to do. You're just going to stay on the surface, identify the structures that are important. That's basically all you have to do, right? So and that's a skill. That's pretty much what you are being valued at that point. So you have learned to do that. So everything, each of the different surgeries require different skills, and so this specific surgery focuses mainly on identification and staying within a certain region, right? So there's something called a Kaplan cardinal line. So it's the crease which you have at the at the end of your first thumb, somewhere around. So just yeah. So it's just the crease which you have going horizontally just at the end of your thumb. So that's one. So now you're making the incision. There's somewhere around the third finger and the Kaplan cardinal line, which is the horizontal limit. So you're making the incision. Let's just say about that. We don't want to get too complicated. You're making the skin incision and you're going in with the layer skin, and there's some subcutaneous tissue. And then there are some white palmar aponeurotic fibers. You have to understand that these fibers are white, right? If you can't see them, you might want to just slowly, maybe, what do you say, mop it with some gauze swabs and identify that white fibers, because after that is where you will identify the transverse fibers of the carpal ligament. So unless you, so those aponeurotic fibers are an indication that you are going deep, you're coming close to the transverse ligament which you need to release. So when you come to the transverse ligament, again, you are already, by now you already would have switched off to a much less sharper blade. So an inside knife, they were some would say. So you can go with an inside knife. So slowly, so with the less sharper blade, you're going in. Now again, you'll be slowly going through this layer. So you don't need to really make a massive hole, just a small incision is enough, through which you will place an instrument beneath. So you go beneath, so you make a small incision, you go beneath that, You use an instrument to protect the structure that is beneath it, which is the median nerve. Now, you are doing the surgery so that you can release the compression that is brought upon it by the tight ligament. Right? So you're releasing the ligament, and you're actually trying to maintain the function of that nerve that is underneath. It's very close. So what you want to do is you want to put an instrument known as the McDonald just beneath that, and you are going to stretch the incision. You're going to make an incision, right, and release the ligament, transverse carpal ligament, superiorly and inferiorly, up to the capsular line, and below you can go a little bit down. And once you're done with it, you can just put the sutures and everything's ready to go. Sometimes, yeah, that's it. That's pretty much it. So this process of identification is what's important. So I hope that is very insightful. Like I didn't get to go into the depths of it, but I think I pretty much covered a great bit of it.